My name's Daniel Whitson. I'm a consultant plastic surgeon. I work both here at Cosmetic and in the NHS. Just to give you my experience on patients who've had surgery abroad, obviously it's a very mixed bag, and I probably see the tip of the iceberg, but we see plenty of patients who've returned from surgery abroad with significant complications. There are certainly providers overseas that do provide a good service, but unfortunately we see those patients who've not had good experience. And those patients can range from patients who are severely unwell enough to be admitted to intensive care to patients who are just not happy with a surgical outcome.
It doesn't look like they have perhaps offered their surgery to the highest standard. I think corners get cut to keep the prices down, and some of the experience of the surgeons involved, in my opinion, seems a little bit weak. So decisions get made that perhaps aren't subsequently found out to be the best ones. But I can only really comment on the patients that I have seen where things have gone wrong.
The main difficulties with having surgery abroad is the follow-up. And if your surgeon lives 4,000 miles away, then it's quite difficult to pin them down. It's also, taking it back a step, quite difficult to find a good surgeon without shopping around, and it's difficult to shop around when you're travelling so far to have surgery. So the key to all of this is making sure that you're meeting a surgeon before you're having a procedure, and you gain trust in that person, and you go through the whole process and the journey with them. So that ranges from pre-operatively, which is the most important part, to post-operatively. The surgery itself is relatively straightforward, in the right hands, and ensuring your surgeon has the right training and the right experience is the most important thing, I think, for a patient. Yeah, so we see quite a few patients who come back with sepsis, and they're just patients who generally have infections post-operatively. We see several patients who have wound breakdown, and we see quite a lot in plastic surgery patients who have implants put in, wound breakdown, and those implants have to be removed. We see complications from patients who have procedures who are perhaps they're pushing the boat a little bit, so they're trying to have too many procedures in one go, and in some patients that's just too much for your body to cope with. In some patients it goes wrong, and if it goes wrong, then we have to almost start again.
I'm aware that some patients have ended up in the intensive care unit following surgery that's become significantly infected abroad.
We see complications from surgery abroad every week, I would say. I would have a significant admission to hospital on a weekly basis, and that's just in our hospital in this part of Scotland. So the burden on the healthcare service for those patients is, based on that as a sort of snapshot, pretty huge. Wow. And it's increasing. Make sure that they find a surgeon that's right for them. And I think that's impossible to do if your surgeon's on the phone or you're having a video call miles away. I think you've got to meet that person, and I think you have to know the track record. And I would always encourage someone to have surgery where their follow-up is available locally. We do operate on patients that are a little bit further away, but we have outreach nurses in various parts of the country who can help with that. I think it's difficult to not criticise, because we see a particular part, and of course any surgeon can have complications, any hospital can have complications, but it's a big theme, and I think it would be difficult for me as a consultant plastic surgeon to find a good clinic or hospital overseas. It would be impossible. So how a patient can find it?
I certainly have reservations. There's a lot of patients that do go abroad and have very successful outcomes, but unfortunately there's more than we would want who have their surgery performed by inexperienced individuals or in facilities that don't really have the backup. Surgery is unpredictable, and occasionally some extra facilities are required, and I've certainly had my fair share of patients returning from abroad where things haven't really gone very well.
Yes, and I feel as if I've been talking about this now for probably about 7 or 8 years. The volume of patients has certainly increased during that time frame, and I think that's because the volumes of patients going abroad has also increased. Um, it's quite disheartening to see um, when you see those patients coming back and the experiences that they've had and the outcomes that they've had. I think personally, these providers have tried to do too much in one day, whether that be too many patients in one operating list or too many procedures on one individual patient at the same time. There's only so much that your body can take. I think the one that actually sticks in my mind the most and the one that hits hardest is the patient who didn't return from surgery abroad. It was a young lady that we'd consulted for a weight loss procedure. She wasn't suitable. A week and a half later, she went over to Turkey and went through with that procedure and unfortunately passed away. And I think that story will probably haunt me for the rest of this industry. So it's clearly something that's quite difficult for me to talk about. Even after all this time, I still get really emotional about it because of what happened to that particular patient and the experience that her and her family went through, which was devastating. It should never have happened. How that whole incident was managed and the fact that the surgeon was back operating again, literally within hours of her dying, with no real consequences, is unfathomable for me. It's really difficult for patients as well because even if you go back and look at that particular case, if you FBI level investigate that online to try and find out who was responsible, what hospital, what surgeon, you're not going to find it because nobody is allowed to speak about it. And that's the most frightening thing. So how can patients possibly do thorough research when everything is covered up? In all honesty, after everything that I've seen now, I would still say don't do it. Wait, save your money, don't do anything. It wasn't that long ago I looked at teaming up with a hospital in Turkey and I thought that would have been a way to maybe mitigate the risks and manage the process and ensure patient safety at a higher level. It's simply not possible because the cultural differences between the two countries, the approach to medical ethics, the approach to surgery, even if we were doing the consultations and the aftercare here and monitoring what was happening in aftercare over in the other country, you can't provide care to the same standard. You can't make sure that everybody's going to be well looked after. Plus the travel in itself, that increases risks as well. I think I'm just at the point now I can't endorse surgery abroad. It's just not safe. Probably the key things that I would be looking for if you're going for surgery anywhere, but probably more so if you're going for surgery abroad, is any sort of pressure on you to convert within a certain time frame to have surgery. So for instance, if you go for a consultation and they're urging you to sign up on the spot or part with a deposit or take a certain date, that's a red flag. That's not in your best interest, and it's something that I would definitely tell you to be considering what their motives are for doing that. Um, Likely so here in the UK as well, because as much as that's against all ethical practice, some people will still try and do that. If you are getting one price one day and then a couple of weeks later they're calling you back with a cheaper price to try and get you to convert, again, that's a red flag. When you're talking about surgical procedures, it should not be about conversion, it should be about suitability. And yeah, I get price point is obviously going to be a sensitive topic for some people, and there's ways and means to make it more accessible, which is why we offer the patient experience packages. But if that cost is coming down and down and down to try and get you to hurry up and decide to have a procedure, you really need to think about how they're going to be able to provide that full service and the aftercare, any revision that's needed, and meet their obligations as a provider at that significantly lower price point.